You're already 6 years invested. You're already hundreds of thousands of dollars invested. What if you find out that this really isn't something that you want to do? What do you do then? Hello everyone, my name is Dr. Thomas Hughes. I'm an adolescent and adult psychiatrist in Southern California. I have not done a reaction video in a very long time, but this video brought me out of hiding. Let me set the stage for you. This is Dr. Goobie. He is a neurosurgeon that's around 38, 39 years old, who made a video a few weeks ago describing why he quit his very prestigious job as a neurosurgeon. Now, so far this video has accumulated nearly 10 million views at the time that I filmed this video, so it's definitely made an impact. Quitting medicine is actually not unheard of. Quite frankly, doctors quit medicine all the time for various different reasons. In this video from Dr. Goobie, he gives his reasons. You know, there's some things that I think I can add insight to, and that's the purpose of this video. Insight, not from his perspective, obviously, because I've never met him before, but generally speaking, I might be able to add some insight and some other things to think about to add to this video that he made that I think made such an impact. And I think it's important to talk about some of these things in case someone is thinking about becoming a doctor, is currently a doctor and struggling, or maybe you're just somebody that's curious about what it's like from a doctor's perspective. So without further ado, let's get into it. Initially, I wasn't sure if the guy was actually a neurosurgeon because the numbers just didn't add up for me. You know, if he's 38 or 39 years old and he's been a neurosurgeon for 10 years, that means he finished residency around 29 years old, and that means he graduated med school around 22 or 23 years old, and that means he started medical school at 18 years old. He might have started MIT at the age of 15. So, which is insane. That's very impressive. I mean, insane in a good way. That's very impressive. Long story short, I was eventually able to find his credentials and a video from this doctor that verified actually working with him in her residency program.
I worked alongside of him for 6 years of my life. Incredibly smart guy, a good doctor, and more importantly, a great surgeon.
So for anyone with questions as to whether or not Dr. Goobie is actually a neurosurgeon, as far as I know, that seems to be legitimate. The next thing that I want to talk about is the word disillusionment. It's defined as a feeling of disappointment that results from the discovery that something is not as good as one believed it to be. And this is going to be a key, and I mean key word to understand throughout the entirety of his video and even mine as well. I think for you as a viewer that may not be in the medical field or maybe interested in getting into the medical field, again, I just want to reiterate that what he's saying and what he's describing is not unheard of. I even have video evidence of it right here.
I joined the private practice, I started working, and I realized that this is a disaster. I couldn't understand why. I didn't know why I couldn't do it. You know, we were just writing narcotics to anybody and everybody.
This is post or during training? Post training? During training.
During training and post training. Because, you know, in training, it's one thing. Attending tells you, okay, this is what you do. You basically can give these meds and then you inject steroids into spine and into every joint. So I thought it was okay, cool, fine, no problem. But then when you start taking care of the patients yourself, these become your patients, and you are very invested in the outcomes. When you start taking care of the patients yourself, these become your patients, and you're invested in the outcomes. And what we did, we just put these people on opioids, on tremendous amount of opioids. And after I started seeing really, really bad outcomes, it was just, the outcomes were disastrous, okay?
What year is this?
Disastrous. This was close to 2010, 2011.
Got it.
Scientifically, I couldn't understand, hey, you know, everybody was doing it, I was doing it, I was trained to do it, but something felt really, really wrong. You know, we had people dealing our medications in the parking lots, we had people overdosing, we had people lying to us constantly.
If you listen to what he's saying at the beginning of the video, you can hear the positivity. You can hear the desire to help people.
I became a doctor to help people, And I remember at the beginning of medical school, when I was just starting, there was one of the older faculty docs, and he said that your job as doctors is to relieve suffering. It's not to do a surgery or give a pill. It's to relieve suffering. That might be from doing a surgery or a pill, but it might be just listening, acknowledging what someone's going through. That stuck with me all through medical school and residency and afterwards. And at that time at my medical school, there were some researchers working on connecting brains to computers. That was really interesting to me, and there were people working on that. And so I wanted to go into neurosurgery, and so I spent 6 years learning how to do both brain and spine surgery. And I did some research. But as I did more research into the problem, I found that this dream of being able to give people robotic arms or legs, I don't think will ever happen. And
Disillusionment.
that's because
Once you get into your third and fourth year, and even residency, that's when you start to transition from the classroom into the hospital.
Shit just got real.
Now you start working more with patients. Now you start to meet other doctors. Now you start getting involved in research and figuring out what you want to do specialty-wise and getting to test it out to see if that's actually something that you want to pursue further. Basically, things start to get real. Before that, you're just sitting in a classroom, not that much different from, what you get in undergrad. The saddest part about that, and I do mean the absolute saddest part, is remember, if you're in your third or fourth year, where I think things start to get more real, and you start to really get experience about what it would be like to be a doctor, that means you already completed 4 years of undergrad, 2 years of medical school. Now, I know there's a lot of variation into how much tuition can cost for undergrad, but medical school, I mean, you're talking anywhere between $40,000 a year to $100,000 a year. So it's not unheard of for some medical students, I might be one of them, to accumulate anywhere between $100,000 to $200,000 just from those first 2 years of medical school. And again, that's not including however much your undergrad cost. That 6 years is not an easy 6 years. You can ask any pre-med student about biochemistry and the MCAT. If you're able to pass those classes, such as biochemistry and chemistry, all those classes, and then do well enough on the MCAT to matriculate, by the time you realize what it takes to be a doctor, and I mean really understand what it takes, remember your third and fourth year, it may already be too late. You're already 6 years invested, you're already hundreds of thousands of dollars invested. What if you find out that this really isn't something that you want to do? What do you do then?
from 20 to 29 years old, it's like the prime of my youth. I had invested it in doing medical school and learning how to do brain and spine surgery. At the age of 29, I realized that where I wanted to go, I would never be able to make it. It's just not possible. And after putting 9 years of my youth into that job, I didn't want to throw that away. So in my last year of residency, I learned how to do spine surgery, because that's what most neurosurgeons do.
You can, of course, cut your losses, turn back, call it quits. No shame in that. Somehow find a way to pay back those loans at a later date. Somehow find a way to deal with the shame or embarrassment from not being able to finish. You could also do path 2, which is push forward, because you've essentially passed the point of no return, right? Financially and emotionally. So you can just keep going and hope that things get better. What if they don't? What if they don't?
I kept going to work and I kept doing my best to do a good job. But it tore me up inside. And I knew that if I kept going back to that job every day for another 20 years, I would die before 20 years. My body and mind and soul, they would have just broken down, and I don't think I would have made it. I wouldn't have made it to 60. So I knew that something had to change, but I was stuck. I was the breadwinner, and I think a lot of people can relate to this. I think a lot of people may feel this way. I knew that I was dying. I was dying inside.
This dilemma is something that medical schools look for when they're interviewing people and looking at applications to school. Oftentimes when people talk about how difficult it is to get into medical school, and trust me, it is difficult, it is competitive, people tend to focus on things like grades, the MCAT score, how you interview, and all of that stuff is very important. But another thing that I think medical schools look at is, does this person know what they're getting themselves into? Like, do you know how difficult it is to work with insurance companies? Because they're not just gonna always agree with your decisions. Do you know patients aren't always gonna take your recommendations, and that you can't save everybody even if they take your recommendations? Even if you do everything correctly, you can't save everybody.
I could do a perfect surgery and some people would get better. Some people would stay the same. Some people would get worse, even though I did the exact same perfect surgery. And some people would get better before I could operate on them. Even with gigantic bulging discs, actually being out there and practicing and seeing what happens to people, I realized that, whoa, wait a second, this isn't quite what I thought it was. I thought that if I do a perfect surgery, people are going to get better. And it wasn't always the case.
If you do a simple Google search, you'll see plenty of studies, plenty of surveys that will show you how unhappy a lot of doctors are. Just from personal experience, I can attest to that. I've seen plenty of people come and go from undergrad to medical school and residency, and it's not pretty, to see an unhappy doctor, because it not only affects them, it affects their family, and it affects their patients. Did you know that medical students are 3 times more likely to commit suicide than the rest of the general population? Now that's just medical school. Not to mention after medical school, the rates of divorce, the rates of depression, the rates of anxiety, suicide completion, suicide attempts. I'm listening to this guy talk about the 40-pound weight gain, how he was the most unhappy that he's ever been in his life, and no longer believing in what he was doing. I have more questions that I would ask him about all that, but bottom line, that doesn't surprise me that someone would have been experiencing that if they really did not like what they were doing for a living. This sounds like a classic case of burnout to me, which can come in many different forms. The classic symptoms of physical and emotional fatigue, feelings of hopelessness, just a lack of motivation overall for what you're doing. You might not be surprised to find that a lot of these things sound very close to symptoms of depression. If you are experiencing burnout, ask for help if you need it. Ask for help if you're not doing well. Ask for help if you're not sure. I would be curious to know if Goobie asked for help throughout that 20 years at any point in his life. And I would also be curious to know if any of that help was actually made available to him. If he did enter medical school at the age of 18, I think his age absolutely played a role in what happened here. I wonder if he was, a little older, when he was pre-med, whether, he would have had a different viewpoint about how medicine worked. Someone who enters med school in their late 20s or 30s, sometimes even their 40s, certainly have a more realistic view on how healthcare works than someone that's still a teenager. Just by the amount of times that, just virtue of being older, you touch base with the medical system and have to deal with insurance companies and things of that nature. There is no doubt in my mind that he was capable of doing the work. But I think in this case, it's not just the work that was a problem, it's how different the work was from what he expected to be. On the topic of quitting with no real plan, I agree there's nothing to be embarrassed about, but I would not recommend this for most people, doctor or otherwise. Me being a psychiatrist, I've seen plenty of people who are working jobs that are essentially just destroying them emotionally, to the point where, you might be getting money from this job, you might be able to pay your bills, but what good is a big house, nice car, if you're not stable enough to drive it? If you can't get out of bed to enjoy your house, if you can't get out of bed to drive your car. But with that being said, I think planning to switch jobs, either emotionally or financially, I would recommend that. I think the decision to leave medicine is easier if you don't have kids. And if you make a neurosurgeon salary, they can and do make a lot of money. They work a lot of hours, but they still make a lot of money. For most people, you're not going to be able to go out and live in the woods for a year or wherever the hell he is and to spend time with their dog like this. It looks great, but it's just not feasible for most people. I want to respond to one thing in particular was his issues with the way that we practice medicine in the United States. Overall, I agree with him. It would absolutely be best if we were more focused on prevention instead of treatment. Absolutely agree. We don't have many cures in medicine. We've got surgery and antibiotics. Everything else is, for the most part, is treatment. And as you heard him say, even the surgeries that he was performing ended up being more treatments than they were curative. I just want to be very clear with what I'm about to say and careful with what I'm about to say. Although I am not happy with the system, although there are changes that I might make to it, this is the system that we have in place. This is the system that we operate in. And this, again, I'm bringing this back to what I'm talking about in terms of the disillusionment with our current healthcare system. I think it's great to dream and imagine a better and healthier world, but this is what it is. It's not perfect. I would make tons of changes, but this is what we have to work with. And I'm speaking as an adolescent psychiatrist. I wish we could ban cell phones from anyone below the age of 16, but it's not realistic, and it's not gonna happen. Alcohol is another thing that I think is deadly and poisonous, but readily sold on the market to anyone that's old enough and easily accessible to people that are not old enough. Alcohol kills tons of people every year, makes people sick every year. I think more than any other substance, but it's not going anywhere. It's not going anywhere. For me, the amount of people that I'm able to help outweighs the shit that I detest about some of the things that we encourage and allow in our society. Bottom line, it outweighs it. But you have to keep the bigger picture in mind, in that even though you're not able to help people, not able to help everyone, you are able to help some or a lot of people, depending upon how you practice medicine. And that's what you have to keep in mind. But at the end of the day, I hope Goobie finds his way. If he's interested in learning more about his patients and pursuing treatments where he can spend more time with them, because with surgery, there's not that much time to talk to them as much as he might like to. They spend most of their time in the OR. If he's interested in changing maladaptive behaviors, I say have at it. Do whatever feels right for you. He's got every opportunity to do so. He seems like a very intelligent and a nice guy, a very intelligent guy and a nice guy. As far as my speaking on his video, I do so with the utmost respect. Yes, I commented on Goobie's video, but my commentary was intended to speak on situations similar to what he was going through during his medical school and residency and training as an attending. I've never met the guy, tons of respect for him, and I thank him for coming on camera and telling us all about his story. But again, at the end of the day, I realize he's not happy with the way the medical system is set up. Again, I think a lot of doctors would agree with that, but I also think there's a lot of us that are still working with patients or working within the system so that we can help as many people as we can. Anyway, that's all I got. Take care.